Our next guest is Dr. Daniel Brubaker. Do I say it correctly?
You just said it correctly.
And you have a medical business here in Fresno.
I do.
You've been at it for a little time.
I've been in Fresno since 1993, and I've been doing what I'm doing currently since 2000.
2000. Now, we invited you specifically because there's some things going on in our community and in the state. Different marijuana laws have passed and stuff like that. But I understand that you're a doctor, that if a patient goes to you and you find that they have a need that can be helped by using cannabis, I guess you call it, you might be able to give them the prescription or the...
It's called a recommendation.
Recommendation, right.
So, yes, I got started with this in about 2006. So this is my 10th year anniversary. And the way I got started was I was doing a lot of workers' comp and mainly taking care of patients until they got surgery with medications such as narcotics. Then I started doing more pain management with narcotics, and it was terrible. I really hated it.
Yeah.
And I had two patients tell me, why don't you do cannabis recommendations, because we don't want to take narcotics. And that was my start in 2006, and I've been doing it ever since, very legitimately, and really been helping a lot of people with it.
Okay, so people who need it, I mean, it's better than narcotics, which seem to badly affect the body, the brain,
Exactly.
and you could develop a dependency on narcotics.
Well, they say, I don't know exactly where the figure comes from, but there's one death from opioids every 9 minutes. And with cannabis, there's never been a reported death.
From cannabis, right. That's what one friend of mine always says, you don't find people who smoke pot then go home and beat their wife.
No.
So it's not a violent drug, not a drug that causes death, and maybe it's a natural way to relieve pain?
Well, it's a plant that I believe God put on this planet to help people. And I don't know of any other plant in the universe that helps people as much as this plant does. There's things like digitalis that comes from foxglove plant that helps people with congestive heart failure. That's only one thing. This helps so many different things, like helps people sleep with insomnia. It helps pain, stress, all kinds of different things.
I never thought of that. I'm an insomniac. My brain runs 1,000,000 miles an hour. I'm not a marijuana user, and I never thought, well, maybe that would just put me in the zone to fall asleep. So, but I need to get a prescription for that, though.
So what happens is we're located at 3726 North First Street. The cross street is Dakota. And people call and make an appointment. We take appointments only, but occasionally some walk-ins. And I do a complete history, physical examination, and I determine whether or not they meet the criteria for the cannabis.
You listen to their heart?
I listen to the heart, I listen to their lungs, I examine whatever body part that they're having problems with.
I had a doctor once, and I called him and said, you know me, and I had this prescription, it's expired as antibiotic, and I was having teeth problems or something, and they go, no, I'm not going to subscribe to you something if I can't listen to your heart and make an evaluation. So you do the same thing. You don't just pass it out.
I do exactly the same thing, and I'm not what you would call a pot doc, because I do general medicine, I do workers' comp, see injured workers, I see personal injuries from motor vehicle accidents, I have Medicare, private PPO patients. I don't do any managed care, no Medi-Cal, but I do everything else. So I enjoy medicine.
Now, there's a big distinction that should be made here, because this is legal. Whether you like marijuana or agree with marijuana or not, what the doctor's doing is legal, right? And it was passed by the voters, I guess. And people are always trying to, let's punish things we don't agree with. Let's add a couple dollars tax on cigarettes, or let's tax SUVs, or let's tax bullets. Well, if the item's legal, it's legal. And it shouldn't carry a stigma. And more and more it's not, I believe.
Well, it's interesting. The medical side has been frowned upon, and now all of a sudden it's become legal for recreational use, which I've not been supportive of because I think it gets into children's hands quicker, and there's a lot of problems dealing with the recreational side. The medical people are really responsible. They know when to use it, how to use it. Some of the cannabis now has very little THC in it, but the high CBDs, which are the cannabinoids, and there's about 60 to 70 of these in the plant, helps people with pain and epilepsy and all kinds of things.
Now, when people say medical marijuana, I think of smoking it. I guess there's other ways to take it now.
Oh, there's so many different ways. There's edibles, and I tell all my patients to be careful with that because it's metabolized in the liver, and so about 60 minutes later, it's going to hit them. And so if
60
they take
minutes, so
at least 60,
well,
maybe a little bit longer.
Half hour, 40 minutes later, you feel okay, and then all of a sudden you're driving down the road and boom.
Yeah, exactly, and that's why I don't like it in terms of recreational. But I get a lot of first-time patients never even tried it, but they read things in the literature. Parkinson's patients I get that read about it, and Alzheimer's. So there's so many different things that it's been helping, and I actually get referrals from other doctors because I do it the way it's supposed to be done.
They don't know about it enough to make the reasons and responsible decisions that you do, perhaps.
Exactly.
Okay. Now, who should come see you?
Well, anybody with chronic pain, musculoskeletal type pain, cancer pain, I get probably 75% of it is chronic pain, and so I see myself as a non-narcotic pain management doctor. There's a whole variety of different things. Migraines, it reduces the frequency and intensity. Anxiety, ADHD, let's see, arthritis pain, I said seizures, I believe. There's a whole host of things that they could come see me about.
But if they're curious about, they don't like their traditional medical treatment, or maybe they don't want to be putting all the drugs in their body, but they feel a need to, have some treatment, I guess it wouldn't hurt to come talk to you.
No, and what I do is I review all their medications, and a lot of patients want to get off of some of their medications, so I walk them through that in terms of how to wean themselves off the medications and use the cannabis. So I think that's really important, and that's a part of the medical side of the cannabis, and it really helps people with their problems.
Okay. And how should they contact you if they would like an appointment?
Our phone number is 559-248-0116 or 0117. If nobody picks up right away, it may be because we're busy, but keep trying. And then we also do get some referrals from the internet. I think it's medical or cannabisdoctors.com.
Okay.
And so there's different ways to do it.
Yeah. And I'm not going to put down any other doctors. We don't do that here, but there are people who are called pot docs, who are there to make the money, writing the prescriptions. But you seem to have a more full medical experience on it, and how it will affect people, whether the edibles, the whole experience, that maybe you could explain better than a lot of other doctors are just
Well,
in it for.
some of them do explain, but a lot of times they seem to run the patients through a lot faster. I take my time with them, and I'm an osteopathic physician, which is separate from a MD. But what's the difference? We were taught more musculoskeletal type things that deal with, and we examine the patient. We treat the whole patient, and so my whole process is to take care of the whole patient.
The patients aren't coming to you because they're totally well. They're coming to you because they have
Exactly.
an issue that they need some kind of treatment for. Now, what about the anxiety issues?
I have patients that just come for anxiety as well. and they always have some sleep problems. Women especially have a lot of muscle spasm in their upper trapezius muscles, and that they have this kind of syndrome between muscle spasm, headaches, and anxiety, and problem sleeping. It covers all of that.
Okay. Okay, which that anxiety and the spasm stuff leads to the headaches and
Exactly.
migraines.
Exactly.
Sometimes. So maybe a little marijuana before you sleep in whatever form. I don't know that much about it, but maybe it could relieve some of that.
Well, in terms of the different forms, I didn't really go through that too much, but yes, there's vaporizers, there's capsules, there's edibles, smoking it, tinctures, which you can put under the tongue. You can actually spray it in your mouth. There's all different kinds of ways to
Do you
use it now.
recommend ways, or do you have
I
a
do
source for that, or you just write the recommendation and they go somewhere?
I walk them through it in my office.
Okay. During an appointment. Where
Yes, exactly.
You've examined them and you're giving them the best medical advice. So, yeah, I guess that trying it, I mean, people dumping all these pills. I don't know if doctors get paid kickback from prescription medicine, or is that against the rules?
No,
They
that's
don't.
against the rules. Yes.
I was wondering why they do so many prescriptions.
You know, it's because that's what they know what to do.
That's their training, and that's the tradition, I guess.
I'm a little more open-minded, and I try to use all kinds of different techniques to help the patient. I do joint injections. I do trigger point injections. We do some manipulation, some ultrasound. So there's a whole bunch of different things that we can utilize in our tool bag to help patients.
Is that more the training of an osteopath than an
It
MD?
is a little more, yes.
More holistic? Would you call it holistic?
More holistic, yes.
Okay, whole body, holistic. Anything I could go on for another half hour, but there's signal us we went way past time. Is there anything you want to add before we're out of time?
Well, I'm just happy to be here. I'm glad you invited me, and I hope that this has been educational for patients in the community.
Yeah, and you know, I did want to mention or bring up at some point during this is that I guess the state did make it legal for recreational use, but you can't buy it anywhere. So if you're not growing it and you really feel you need it, going to get a recommendation from a doctor such as you would make it legal for you to go into maybe a clinic or something
Yes.
and obtain it.
Yes.
So people with that recommendation are the only ones who can go legally buy it somewhere. So,
Correct.
So stay within the law. It's so much easier. It makes your life a lot easier.
It sure does.
Doctor, I'm going to ask you one more thing. Dr. Daniel Brubaker, and tell us again how people should contact you to set an appointment.
They can call 559-248-0116 or 0117.
Okay, and if you have trouble reaching Dr. Brubaker, call us here at Central Valley Talk. We'll put you in touch with him. In fact, I think we're just going to be running your name and phone number, how to contact you, and maybe about an hour,
Okay.
one time each hour over the next month or so. And but if you can't reach Dr. Brubaker, call us here. We'll put you in touch with him. We'll be back with more Central Valley business right after this.